So good afternoon, everybody. Gulati, and thank you for mental health and viral hepatitis. So you must be knowing about the same. So I'm gonna just quickly give you the basic introduction of viral hepatitis, and then we'll be moving on to discuss about mental health and the perspectives involved. So it's a viral infection that causes inflammation of the liver. It has many types like A, B, C, D, E. A and E are caused by ingestion of contaminated food or water. B, C, D are caused by contact with contaminated blood or body fluids. Type B and C lead to chronic disease. So I want to ask you one question: that are we all aware of this word mental health? Anybody? Anybody can just try to answer this. This word mental health. Do we have any idea for the same? What is mental health? Anybody? You can let me know.
So, Jyotsna, they are responding on chat box. You can check that.
Okay, moral support, mental well-being with normal behavior, alcoholic patients with hepatitis, state of mind. Okay, so basically, as we all know that being healthy is very important in nowadays. So mental health is something that we talk about our emotional, mental, and behavioral health. So it's just like that, how we feel, how we act, and how we behave in a certain manner. So it is a state of well-being in which every individual has like realizes his or her own potential and can cope up with the stressors. Normals can cope up with the normal stressors in a more productive manner, and who and can work productively, fruitfully, and able to concentrate or contribute to his or her community with. So we can call it as a good mental health. If a person, it is just like that, how the person is acting, how the person is behaving despite having all the stressors. If he or she is acting in a more like and can is managing all the stressors or all the daily household or everyday chores, then the person is in a good mental health state. But if he or she is not handling those things or those household or everyday chores despite having certain stresses, then the mental health needs to be get in check. So it's common to have strong reactions, fear, anger when one is diagnosed with hepatitis, HBV, and HCV. Mental health and hepatitis usually co-occur. They are more prone to develop infections like viral hepatitis, etc. These viruses are linked with psychiatric conditions in both adult and children, according to the American Association for the Study of Liver Disease. HCV are usually associated with more risk to develop anxiety, depression, and insomnia. So are we all aware of this word anxiety, depression, and insomnia? You can share your views in the chat box. Anybody? Any anxiety symptom or depression symptom or insomnia? It's important to know these symptoms, because whenever the patient will come, yes, Dr. Deepak has written here feeling low. Yes, it is one of the depressive symptom in which persistent mood or persistent sadness of mood is there. Then anybody? Yes, low mood, low interest, lack of initiation, that we called it as anhedonia. Restlessness is a symptom of anxiety. Yes. Anything else? Yes, not performing up to the mark is one of the symptoms. Hopelessness is one of the symptoms. Yes, quite true. So if we talk about the anxiety symptoms, then of course, as the name suggests, it is the flight or fight response in which majority of the symptoms occur. Yes, I'm just discussing it over. Somebody has written paranoia, scared of future. Okay, this is not a symptom of depression and anxiety. So fear, cold and hand, feet, these are the symptoms of anxiety. So let me just discuss it over with you. So when we talk about the anxiety symptoms, the flight and fight response are included in the same. Then the symptoms involves your cognitive symptoms. It means the psychological symptoms, which are as follows: lack of attention and concentration are there. The person will be confusional funds. Then of course increased sleep or decreased need of sleep was there, is there. And then this restlessness is there. Then appetite changes are there. Gastrointestinal symptoms involves indigestion or abdominal discomfort. Then some people might feel palpitations, which we call cardiovascular symptoms. So these are the symptoms in which a person can feel, can be anxious, that can feel these kind of symptoms. When we talk about the depression, then depression involves three major symptoms, which are as follows. So number one is persistent mood of sadness. Number two is negative thinking, in which the person always thinks that the world is going to end, or everything he thinks, or any stimuli can comes up to him will be negative. Then anhedonia, which means that which are the activities earlier pleasurable to the person are no more pleasurable, like watching TV, cooking, going to the office, dancing, singing, whatsoever. So that is no more pleasurable to the person. This has, of course, this also includes hopelessness. Then other self-confidence changes, self-esteem changes, appetite changes. But these three symptoms are the more common ones. So I've just talked about that. When we talk about the insomnia, then insomnia is a person, when a person is feeling difficulty in sleep 3 days a week till 3 months, then it is the insomnia. So person might get a problem in initiation and maintaining of the sleep. So if the timeline, if he or she matches the timeline, then the person can be diagnosed as insomnia. Moving forward. So counseling. So what we covers up in the counseling. So here in regards to the viral hepatitis, we promote the testing awareness. That testing is very, very important in this certain situation. We focus on specific population. We create an enabling environment. We kind of reduce stigma and discrimination. Then WHO has given the 5 C's for hepatitis testing. Then consent, as we all know that this is a very important word, consent in the medical profession. So the person must give informed consent. Then verbal consent is sufficient. The patient has right to decline. Then each person has the private opportunity to opt out of the testing. The second important C is confidentiality. So this is again very important ethic in this profession. Then ensuring a confidential setting and preserving confidentiality is very, very important. This will help you to build a therapeutic alliance with the patient, and he and she will open up to you accordingly. Then not only to test result, but also to other personal information. Then the third point involves lack of confidentiality discourages people from using testing services. So this is very, very important point in 5 C's. Third is counseling. All people should have the opportunity to ask questions. So in this, some people has the, due to this overwhelmed reactions or fear of shock and other reactions, the patient might ask you questions again and again. In that, our approach should be polite and supportive in order to maintain the patient in the treatment. So post-test counseling is important. QA mechanism as well as supportive supervision and mentoring service systems to ensure the provision of high quality counseling. Then the correct is there. The person has to see high quality testing services, quality assurance, in which including support from the National Reference Lab. Connection in this linkage to prevention and treatment and care services should include effective and appropriate follow-up, including long-term prevention and treatment support. So then providing the testing information. Then viral hepatitis and the benefits of testing for hepatitis B or C and the meaning of positive and negative test result. A brief description of prevention options, that what are the prevention options are there, then the confidentiality of the test result as well as information shared by the patient. Then post-test counseling and service, then this is for the patients that who test positive. In this, we have to provide clear information on further tests to be provided to confirm the stage of liver disease. We can assess the need of the referral. We can provide information on prevention of transmission and lifestyle modification. Then family screening and vaccination is important. Post-test counseling and service who test negative. In this, explanation of the negative result is important. The person can offer HPV vaccination, then repeat testing of HCV if patient is of high risk. Then counseling, what you can do or cover up in the counseling when a viral hepatitis patient is there. So medical providers should counsel patients. They should tell the patient the risk of disease transmission, and who are more prone to it, that are family members. Couples or family counseling requires additional training. In case of partners, protection methods should be used. In case of household members, not sharing razors and toothbrushes should be there. Then behavioral health counseling. Now, behavioral health counseling involves certain points in which I'm going to talk about these certain points. So number one is the natural history of hepatitis C virus infection. So in this, the professional should come up with the up-to-date information, or all the health professionals or administrators in the substance use treatment settings, and can encourage the clients to understand the serious nature of hepatitis, risk factors, the importance of liver wellness, screening, treatment options, and ways to avoid the spreading and contracting of the illness. The second point involves standard treatment. So in this, patient in treatment for chronic viral hepatitis might have to manage serious side effects of the treatment while striving to manage their behavioral health issues. People who decide to delay or forego hepatitis treatment must learn new skills to live with their disease. So many of the patients who kind of facing these kind of difficulties, some patients may feel overwhelmed, fearful, and hopeless. So in that scenario, we can just tell them that they can rest as much as they can. They can avoid alcohol and discontinuing the drug use. They can avoid any other substance that can harm the liver. They can eat nutritious and well-balanced meals. They can get the vaccination against hepatitis A and hepatitis B. So the third is common adverse effects. So there are many common adverse effects like bad taste in mouth, cough, diarrhea, dry mouth, ulcers, insomnia, aches, fever, hot chills, cold chills. So there are some ways to manage adverse side effects. So there's this common point which we tell every patient, that they cannot self-medicate themselves. Like if one person is having fever, though they just can't take many medications of their own. So they have to go to the concerned medical healthcare professional for the medication. But there are certain points which we can tell them, and they can try it at home in order to get better. So when we talk about the one side effect, that is bad taste in mouth, we can always tell them that they can try sugar-free lemon drops. They can eat a small amount of yogurt half an hour before their meals. They can eat dark chocolate or drink lemonade or cranberry juice. They can brush their teeth frequently. When we talk about cough, then they can use a like steamer, or they can try a sugar-free hard candy or cough drops. Then diarrhea is one of the side effects. Then in that they can avoid spicy or acidic foods, or they can have plenty of fluids. When it comes to dry mouth or mouth ulcers, then they can avoid mouthwash that contains alcohol. They can drink plenty of water. Then in terms of dry skin or rashes, they can avoid long hot showers. They can use moisturizing soaps and lotions. They can avoid fabric softeners. They can rub or press on the itchy areas rather than to scratch them. And when we talk about the insomnia, then they can go to bed and get up at the same time every day. They should not read, eat, sleep, eat on the bed. They can avoid caffeinated products, especially in the afternoon and at night. They can avoid the heavy meals. They can take warm bath and read or listen music and get a massage, or they can have a warm glass of milk when going to the sleep, because milk is a natural sleep agent. So when it comes to fever and chills, of course, they can use a cool sponge bath or a ice cold pack or extra blanket in and clothes, but they cannot take the medication without asking to the concerned professional. So when it comes to the fatigue, they can try a low impact exercise. They can lessen their work schedule, and when it comes to the muscle and body aches, they can apply warm, moist heat or massage affected areas. And poor appetite is one of another side effect. So they can eat small or more frequent 4 to 6 meals throughout the day. They can try protein drinks and snacks. They can eat whatever appeals to them, even when they are not hungry. So these were the adverse side effects. Then how to work with the high risk population. So in this, there are certain points which are as follows. We can always encourage our patient to ask their medical healthcare provider for the information needed to make informed decisions about the treatment. We can always encourage them to thorough or informed consideration of the treatment. We can encourage our patient to take action towards improved health or life circumstances. We can assess their mental health and substance use disorder recovery status accordingly. We can help them empathize the importance of alcohol abstinence. We can also help our patients to strengthen their support system. Then management involves mood and cognitive changes. I've already talked about 3 symptoms: depression, anxiety, and insomnia. So we can always assess them and refer them to the concerned therapist or the concerned mental health professional. Then another point involves ensuring the safety. Then this is the treatment approaches. Then using effective counseling strategies, including motivational approaches and other tips includes. This includes the ensuring safety of the counselor. So if a client or if a patient with infectious hepatitis becomes injured and bleeds, then the staff members or even the healthcare professionals are at risk of contracting the infection. So the therapist should use universal precautions such as wearing gloves and other protective gear when exposure to infected blood or other body fluids is possible. Therapists should also know about their hepatitis status to take cautions to protect client and their co-workers if necessary. Then providing reliable information about hepatitis. So providing current accurate information is an important counseling service. Counselors can dispel misinformation about hepatitis by providing educational sessions incorporated into treatment programming. Then the next is building the therapeutic relationship. So counselors can discuss hepatitis in ways that build the therapeutic relationship. Patients are more likely to ask questions and express concerns and fear about screening, a diagnosis of chronic hepatitis and its treatment if the counselor and client having a good working relationship. Helping clients, the next is helping clients to understand their diagnosis. So here, therapists need to be prepared for a range of reactions, because you don't know how a person might act when they'll get to know about their viral hepatitis status. Then some patient might need to talk through fears and anger many times before moving forward with the medical treatment. In these situations, majority of the times, therapists might need to schedule more individual sessions, like 2 to 3 sessions just for the venting out kind of thing, and with the patients to discuss their issue. Other clients might need prodding to understand their diagnosis and take appropriate steps to reduce their risk of spreading the illness or worsening their prognosis. Then the next is incorporating client needs in substance use treatment planning. So substance use treatment planning might be complicated by both hepatitis symptoms and potential side effects of the antiviral treatment. So after that, developing a prevention plan. So when developing a prevention plan involves, patients might continue to put themselves or others at risk for contracting viral hepatitis, especially early in recovery. So here it is important that identification of a specific high-risk incident is important from the therapist side. Then they can always start where the patient is. Like they should not put pressure that you can just remember or think about certain situation. No, this will be a most this will be not healthy approach. Therapists can help identifying a situation when the patient minimized his or her risk. They can help them in synthesizing the patterns of behavior. They can help them in negotiate a prevention plan. Also, therapists can help them to revisit the plan periodically and assess the progress. Then using motivational approaches. So this is very, very important. So by using motivational approaches, the therapist can help clients or patient understand the relationship between a good health and recovery. Mental health professionals can identify the strengths clients have demonstrated in counseling sessions and encourage clients to develop ways to use those strengths to cope up with current health challenges. Next is confronting the social consequences of disclosing hepatitis status. Many people who have viral hepatitis report the social ramifications of hepatitis C diagnosis are severe. For some patients, a diagnosis of hepatitis can generate feelings of low self-worth. Some patients who have viral hepatitis report that their diagnosis caused them to develop a negative sense of self. So for this, they can experience fear, shame, social rejection. So patient might need to use discretion in revealing their diagnosis. Then the therapist can help them by asking that does this person need to know, like household, because they might be fearful to whom should I tell that I'm having this problem, whether the family members, whether the other people. So we can ask them that does this particular people need to know about your current status of health. Then household members need to know, particularly if they are sex partners or likely to share things like razors or hair clip. Extended family members might not need to know. And under some circumstances, employers might need to know. So this is just optional, whether because this comes under, of course, there are, if some particular circumstances are there, then only in that case employers might need to know. Then the second question the therapist might ask, that what is the person likely to do with the information? Is the person trustworthy? The third thing we can help them asking, that it is the right time to tell this person, or what are the risks in telling the person? Is a negative reaction likely? So we can help them, or we can prepare our patients accordingly by asking these questions. So building support system. The next is building support system. So support system, I think I've missed one point. I think addressing relapse is there. So addressing relapse. So in this, a diagnosis of viral hepatitis might increase a patient's potential for relapse to alcohol or drug use. So the diagnosis might also exacerbate depression and anxiety, which are known triggers for substance use relapse. The reason for this are unknown. So although the act of injecting medication or might trigger cravings in patients who injected drugs. So basically, the therapist can start the conversation about relapse by asking the client or patient the following question, that what kind of things make you think using again? Do you consider getting injections during treatment a possible trigger to drug use? What kind of things could help you to avoid substance use? who could support you in these efforts? How worried are you about the possibility of a relapse? Then building support system. Support system is very, very important in this illness. So basically, in these groups, patients educate and support one another about the infection, the treatment process, and managing medication side effects. The support group help the patient believe that good outcomes are attainable. So next is, and the support group also involves peer counseling and support, family support. In family support also, we can just divide the people like who are immediate family members and who are relatives and close friends. We can divide and help them to put certain people under the one component. So the second is providing effective case management. Then in this, providing effective case management is very important for patients who have hepatitis is often the same as for the patient with substance use disorder. But here, if a patient is there who is like helpless and who is having a financial crunch, so we can help them or work with our patient on budgeting or referring the patient to consumer counseling agencies for debt management. We can refer our patients to local food banks, utility assistance programs, and rent assistance programs. Then we can also help the patients by identifying local providers who treat hepatitis and have experience working with people who have substance use disorder when relevant, are comfortable treating people in medication resistant treatment. We can help the patient understand and complete written documents and consent forms. We can work with our patient to establish procedures to help them remember medical appointments and adhere to the medical regimes. Then the next is stigma and discrimination. So stigma is a mark of disgrace associated with a particular circumstance. Stigma is associated with a lack of knowledge surrounding the transmission of viral hepatitis. Fear of infection and lack of knowledge leads to breakdown of intimate relationships. How stigma can be reduced? So by implementing positive messages regarding vaccination programs, raising awareness of the hepatitis virus by disseminating accurate information about transmission, using online support groups and social media, then developing a plan is very, very important. So here we can help them identifying a specific risk incident. Then by focusing on past behavior might be difficult for a patient who feels shame or regret. We can discuss one specific incident that might be less onerous for the patient. We can ask the patient to describe the who, what, where, when, and how of the most recent risky experience. We can keep in mind that some patients will not know how they became infected. Then developing a risk reduction plan for this type of patient might require a gradual supportive approach to identify risk factors. We can help them at identifying a situation when the patient minimized his or her risk. We can help them identifying synthesized pattern of behavior. We can help them with the revisiting the plan periodically and assess the progress. We can help them include vaccinations against hepatitis A and hepatitis B and prevention for other infections such as HIV that are spread in the same ways as different types of hepatitis. Then addressing relapse, I'm just talking addressing relapse in regards to substance use disorder. So a diagnosis of viral hepatitis might increase a client's potential for relapse to alcohol or drug use. The diagnosis might also exacerbate depression and anxiety, which are known triggers for substance use relapse. The professional can start conversation about relapse by asking the following questions: that what kind of things made you think about using it again? Then the second is do you consider getting injections during the treatment a possible trigger to drug use? What kind of use? Who could support you in these efforts? How worried are you about the possibility of the relapse. Then there is a case scenario which I've just involved. So we can just talk it out accordingly. So this is a conversation between a patient and a healthcare professional. So Sarah is a patient. So Sarah says, I don't see what is the big deal about hepatitis. I feel fine. Then the healthcare professional says hepatitis is a silent disease. You could go for years feeling fine while hepatitis damages your liver. Then Sarah says, so I get a little liver damage. I know lots of people who with hepatitis who just lives with it. Healthcare professionals, let's work together during our sessions to better understand what hepatitis is really all about. It's true that some people can live with degrees of liver damage depending upon their overall health. But if your liver gets damaged enough, it won't work anymore. When your liver doesn't work, you become very ill. Your liver performs hundreds of functions that keeps you alive. Right now, your liver is removing toxins, storing the nutrients your body needs, producing the materials you need to digest food, and doing many other things. If your liver stops working properly, your quality of life can be seriously lowered. What kind of life do you want it for yourself? Sarah, I want to feel good and to be able to do all the things like I do. I didn't realize that when a disease is silent, it can actually be doing a lot of damage. I guess I can't ignore my hepatitis and hope that will go away. So with this, I thank you.